Good evening. We are Team-Namaste and our problem statement is to develop an API to integrate Namaste codes and ICD-11 codes via TM22 module into existing EMR system. Before the demonstration of our prototype, let's see the overview of what all things we are going to show. This is the website providing the API demo and its proper documentation. We will see to it later on. For the proper demonstration of API, we have made an EHR model. We have implemented all the operations of API to this EHR model. This is the backend on which our model works. It has the authorization part, all the necessary operations, searching, mapping, bundle uploadations and all. We will see to it. Let's back to the API website. The website is provided with the proper documentation showing how to use the API, also in the CLI command line interface. In the API section, we have the detailed information about the API. Let's see the sample demo of how the API works. For example, we search for the disease Madhumeha. Unified search endpoint shows the map disease codes of Namaste and ICD-11s. We can also export the bundle. We also have the raw JSON response of it. We have add terminology option in which doctor can add the data if they didn't get the search output. They can also upload the JSON bundle of the terms and can also ingest the data in the form of CSV. They can view the JSON form of it and can also download it. Next we have value set operations which checks for the validation of the codes. And the concept map operations checks for the presence of mapped codes in the data if exist. Now let's see a model which shows the proper demonstration of API in our EHR system. Now let's see how the backend of our model works. First, the user needed to be authorized, for example, using the Abha ID. Giving the Abha ID, it will generate the OTP to the user. Entering the ID and the OTP will generate a token value that can be used for the authentication of the user. Now we can fetch the user's data from the database and can also perform the operations using our API. Now let's back to our EHR model. Here is the sign-in option, same for the authorization purpose. Here, patients, doctors, government agencies can log in. Let's log in as a patient using the Abha ID. OTP is generated and we are logged in into our patient dashboard. Patient is provided with their basic informations, what all treatment he has gone through, which doctor he has consulted, and shows all the detail related to his treatment. Patient can generate the report, can print the report if required. Now, clicking on sign out, we are unauthorized as a patient. We again need to authorize, say, as a doctor. And if the user is not registered, they can register themselves, filling the necessary informations and then registering themselves. This is the doctor dashboard in which he can see the patient history, their details. They can also add the patient or either add diagnosis to the existing patient. Doctor need to verify the patient as a concern for accessing their data. This is the patient-doctor interaction page. In this, the doctor can see the report, can also print it, and can also view the patient history, their treatments, their prescriptions. In the disease section, doctor can search for the mapped diseases of Namaste and ICD-11 codes. They can select the diseases, view and add details like prescriptions, comments on the diseases. Doctors can add to the patient database and can also export that as a bundle. Some more operations that can be performed are CSV ignition, FHR bundle upload, value set operation, concept mapping, export the selected part. This is how the doctor can efficiently manage the patient report. Now, logging out as a doctor, let us see the admin page. This page we have made for the government agencies. More users can be added like research companies, insurance companies, medical companies, etc. This is the government dashboard. Government can see the basic details, how many doctors, patients are registered for the system. They can see the doctors database showing the basic information about the doctors. Similarly, in the patient database showing the information about all the patients. Government can also analyze the number of patients, how many are healthy, how many are undergoing treatments. They can also manage the medicine shortage in the area. They can stop the disease spread in the area. Overall, government could have a personalized view over the country's health sector. So, this is our EHR model showcasing the API demonstration for solving a social issue and can be integrated to the existing EMR system. Thank you.